So classification is really important to increase the diagnostic yield, of course, because the problem with neuromuscular diseases is the fact that they are really wide and there are a lot of different etiologies. So sorting them is really important to better diagnose them at the end of the day. So I started by introducing different type of classification. So the first type, of course, is based on the age of onset, because it can be really relevant. If you are speaking to a 35 years old man, for example, you won't think about antenatal cause of neuromuscular disease. Then I continue by explaining the anatomical classification, which is probably the most important classification. So the localization of the defect is really important to get to the diagnosis. So basically it's divided into motor neuron disease, then peripheral nerve disease, neuromuscular junction disease, and finally muscle disease. And then after that, which is also important, is to get to the physiopathological classification. Is the disease either acquired or genetic? And after that, you can also go further by speaking about the mode of inheritance. So it could be dominant, it could be recessive, it could be X-linked. And with that, you have already like a good pictures of what kind of disease you are dealing with. And of course, all this classification can be done by yourself during the patient interrogation and needs to be confirmed during the patient clinical examination, because one and the other can differ. So some people are saying that they are only complaining of muscle weakness in the lower limb, but during your clinical examination you can have problem also to the upper limbs. And based on that, you can also go to the phenotypical classification, which is based on the different type of muscle involvement or nerve involvement on the body to really try to get to the diagnosis. And finally, I did a brief overview about the molecular classification, which is the most complicated one and based on genetic classification. So basically, the disease are then classified by the gene that is affected. And yeah, with that, I concluded my presentation with also other classification that might help, that not as relevant as the previous one, but for example, the prevalence classification. So of course, you need to think about the most important cause first, or the most frequent cause first, and then go back to the ultra rare condition, because of course in neuromuscular disease, you are only dealing with rare disease. Yes, so that was it.